On peut commencer.
So we can start. So we need to question ourselves, as Guy says. I suggest that we talk about governance with 4 key words: the actors, competencies, means, and frontiers or borders. In 2018, the European Commission published a report, a panorama of political results for health over the past 10 years. You listed several negative points. We need to improve governance, like mental health, the fight against obesity, and terrible expenditure. But also, you draw a very positive picture in terms of life expectancy, the improvement of survival after cancer. And we've also reduced the number of smokers. Generally, we've got a lot of success when it comes to national government and policies. We've forgotten something, and the European Commission's point of view in terms of governance. Can you perhaps cite 2 examples where the intervention of the European Commission has been crucial for the improvement of the health of Europeans?
So, first of all, good morning to everyone, and thank you for the invitation to be here. It's great to share our views with you. First of all, I would start to answer your question by clearly outlining how the treaty, first of all, assigns the responsibilities. And the treaty says very clearly that we are not in competition. This is not an issue where the European institutions are competing with member states or regions, but rather defines how they work together. And the role of the European institutions, the Commission in particular, is to support, coordinate and supplement the actions of the member states. And how do we interpret that? First of all, we support in every possible way. So the success of national health policies is also the main objective of the European Union. We support through a variety of ways. We can support transfer of best practices. We have the powerful financial instruments, many programs which are increasingly being used for health. But in some cases you need coordination, because member states also need to have common tools in some cases. For example, common standards. If we take the issue of, for example, the digital transformation which is happening, it's clear this will not happen well without common agreed standards, for example, on interoperability of data. And this would avoid very expensive mistakes. And then in some cases it is necessary to supplement, so to go beyond what member states could do on their own, because the nature of certain problems is that member states on their own cannot tackle. If you have big problems like antimicrobial resistance, or for example incentivizing innovation in pharmaceutical and medical sector, or even addressing cross-border health threats, it's clear that no member state, no matter how well organized and well resourced it is on its own, can deal successfully with these issues, because they are global in nature. And so, this is what guides our approach. I can give 2 quick examples of how this has worked. For example, in the area of rare diseases, we have recently established European reference networks, where we have over 300 hospitals all across Europe, in practically all the member states, exchanging information, data, to treat patients, often children, suffering from a number of rare diseases. And the principle here is that the knowledge should travel as much as possible, not the patient. So we try to help patients to also reduce inequalities across Europe. And also to reduce, for example, diagnosis times, which is at present is still 5 years average diagnosis time for a rare disease, which is too long. And we're already having very impressive results on that, and we hope to build on that, for example, by using the reference networks to conduct European-wide research, clinical trials, etc., to accelerate the vision. Cancer is another area. In cancer, for example, for many years we've had very successful actions. We've developed guidelines, screening guidelines for colorectal cancer, cervical cancer, breast cancer, which are used now by the vast majority of member states. It would have been ridiculous to try to develop 28 different guidelines on how to screen. We're also working on accreditation of cancer screening. We started with breast cancer screening and now also colorectal cancer screening, again to make sure that all European citizens, no matter where they are, have the same quality of care.
Vous parlez des sujets qui sont communs pour toutes les.
You are talking about subjects that are common to all member states. How can the European Commission, the European Union, put to one side its national interests so that states can work together and help governance in the health field?
As I said before, this is not a choice. We don't have to choose whether the European Union does something or member states, because the member states are the European Union. The European Union is a union of member states, and that is the starting point. So what we have to do, first of all, member states are all facing pretty much the same problems. I mean, the non-communicable disease epidemic, but also, let's not forget, threats from communicable diseases are still there and rising. We have the challenge of digital. How we can harness the power of data and artificial intelligence, but in a way which is at the service of health systems and not just a technology-driven approach. That will need the development of standards. It will need the development of a governance framework that people can trust that the health data is being used to advance health and not for other purposes which may not be in the public interest. We also need to make sure, for example, on things, as I said, like cancer, that we also focus our research efforts, for example. And there is a growing pressure also to address the tension between ensuring innovation, so new treatments, but also, and we know also in recent years, the impact of high prices, of the affordability of these treatments. So we need to work together, for example, to develop incentives for access. We have incentives for innovation. We also need to develop, and these can only be European, because no country on its own, when dealing with a global industry, such as the pharmaceutical industry or the medtech industry, can actually achieve this balance on its own. So these are areas where obviously the European Union is very much engaged.
L'Union européenne, elle n'est pas homogène.
So the European Union is not homogeneous. Even if we have a single market, there's an awful lot of asymmetries, failures. There are parallel markets, for example. There are things that are out of stock at national level. What tools are missing to be able to regulate the market in a better way?
Well, there are still far too many inequalities across member states. You have still about a decade of life expectancy difference between the best performing member state and the one that is the worst position, but also within member states across socioeconomic groups. And there also, I think we need to help using, for example, the financial instruments, the European Social Fund and other funds that can help address this. But to answer your question, I see there are two big areas where we need, I think, maybe to refine and develop new tools. First is the whole issue of data. The health sector, with all its sophistication, is perhaps a decade behind some other sectors in the utilization of data. We have to admit that. And so we need to establish common standards, certainly, for example, for interoperability and so on. But more importantly, I would say, is the governance framework. People need to trust that that data is going to be used in the public interest. Considering also that in this digital revolution, we are not dealing just with traditional health actors, but also dealing with, for example, ICT companies that have a lot of expertise and have a lot of ideas, but do not come from the health sector and need also to fully understand and comply with the principles that, and the ethical principles that underline and underpin the European health systems. So that's one area where we definitely, and President-elect von der Leyen has spoken about creating a European health data space. It's in her program for the next 5 years. And obviously we will do that with the member states, things like, for example, registries for cancer, for rare diseases, possibly for other diseases, to make sure that we can also use these to bridge the inequalities. So doctors, researchers, etc., can have access to data for 450 million people and not just for their own. The other area is the issue of, as I said, of how we reconcile innovation and access. I think this is something we need to tackle urgently, because if we don't, there is a growing tension which will lead to political pressure.
Mais comment faire?
Well,
But how to go about this?
Yes. So until now, we've had reasonably successful, quite good incentives to ensure innovation. So in the field of orphan medicines, pediatrics, but we know there are still areas where we need to have maybe specific incentives. I can think here of antimicrobials, for example, or other areas where we may need to look at vaccines, for example, specific incentives for those particular categories. And we also need to have, I think this is something still missing, incentives for access. So why would a pharmaceutical company, for example, make an innovative product available in all member states, large and small, at an affordable price? What could be an incentive? And there are ways and means, possibly, of doing that, for example, by linking the incentives for innovation with the incentives for access, so that they can modulate each other. But these are things which need to be on the agenda and which can only be tackled by all member states working together with stakeholders in a spirit of dialogue, and this is another role that the European Commission could actually help to convene and help create this environment.
Mais les États doivent venir vers vous en termes d'initiatives.
And in terms of initiatives, and in terms of starting the discussion, how do we go about that?
That is always the starting point, of course, because I said our starting point is the need to support and work hand in hand with national policies. The success of national policies is also our success. But the European Commission will obviously not just wait, we will try to meet everyone halfway. So we will make our own proposals. So we have already made proposals on, for example, on health technology assessment, because the reality today, for example, is that maybe only 6 or 7 countries have the capacity to do good health technology assessments. The rest don't. And that means the European market is still fragmented and some countries do not get the information they need to take good decisions. So, but we will continue to make proposals. Of course, then it's up to the Council and the Parliament to change, accept, reject, hopefully not, but, but that's always, you know, how democracy works. But we will certainly be putting ideas constantly on the table.
On a parlé.
We've talked about innovation, data. There are other priorities on the European Union's agenda in the coming years?
I mentioned antimicrobial resistance. This is maybe, you know, Dame Sally Davis, the British Chief Medical Officer, has recently said, you know, it's far more likely that people will die from antimicrobial resistance than from climate change. That shows the urgency of the problem. We are facing a major problem. And we have to think about, for example, incentives. The pipeline of new antimicrobials is, I wouldn't say dry, but it's not what it should be, considering that many medical procedures are highly dependent on antimicrobials. We have the challenge of vaccination. Companies are disinvesting from the production of vaccines. We have a growing problem with vaccine hesitancy. Countries that until recently were free in the European region, free from measles, rubella, are now seeing these diseases coming back, and we are seeing people dying from these diseases. So this is something we need to tackle. We also need to incentivize the production of new vaccines, innovative vaccines. If, for example, we have a growing number of cases of extensively drug-resistant tuberculosis, for example, we will need to have much better vaccines than what we have today. This requires incentives, requires that we focus our research programs, we work with industry, with academia, and of course this is something that the European Union is very well placed to do, because we have a powerful research program. We also have the possibility to create incentives if those incentives don't exist today. So this is all on the agenda, and of course I mentioned the issue of data, but I'd like to end with one point as well. We should also pay great attention. I know there's a lot of discussion on the non-communicable diseases. Everybody talks about the burden that the diseases are causing, 80%. We are still not doing well enough on prevention, with maybe with the exception of tobacco, where we have good legislation, but I think we need to do much more on alcohol, on nutrition, etc. But we should not forget that communicable diseases are increasing and linked to climate change, linked to other environmental issues as well. So we should not forget about that, and we need to strengthen our investment in that area.
Pourrais-je ajouter encore un?
May I just add one priority to your agenda? That is perhaps legibility and transparency of healthcare systems in the European Union. Let us have a look at the results of the study that was carried out by CHAM Ipsos 2019 on the population in France, Germany, Italy and Portugal. The question was, do you know the role of the European Commission on health policy? What is your point of view with respect to the results of this study?
I think the result speaks for itself. It should not surprise anyone, and we see this also reflected in the political discussions in the member states, and it means we have to do more. We have to actually, events such as this are very important, where we can actually go to the member states, meet with the local stakeholders as well, bridge this gap which sometimes exists between Brussels. I'm not speaking about the Belgian city of Brussels, of course. It's this kind of strange concept which is sometimes presented in the media. But in reality, yes, it is a problem, which means we have to explain what the European Union does for people, what it should be doing, to hear what we should be doing. And I think, you know, it's a very legitimate question that people ask. What are you doing and what difference do you make? And that is a question we all have to answer, whether we're at local level, national level, European level. We all have to answer this question. It's a very legitimate question. And I think, the result of that survey, and I've seen similar results in other countries as well, show that, we still need to do a lot more. And you will see in the next 5 years, we will be putting a lot of effort to improve that situation. So I hope in 5 years' time, around back, we'll be able to see a very different statistic.
Merci beaucoup.
Thank you.